Fertility problems in women of childbearing age are increasingly common. Find out what factors make it difficult for this population to get pregnant. This desire for a child can be satisfied by hormonal treatment or other techniques to conceive. The decline in fertility is not a phenomenon that only affects the female body. Men are also affected and may have difficulty in impregnating their partner and improving the chances of conceiving. 30% of infertility cases are of male origin. Alteration of the testicular environment, obstruction of the ducts, pathology in the prostate, problems with ejaculation or erection and alterations in the sperm. 30% of infertility cases are of female origin. Early menopause, endometriosis, obstructions or lesions of the fallopian tubes, abnormalities of the uterus and cervix are ovulatory disorders. 20% of mixed or combined origin. The two members of the couple are at the origin of the infertility. 20% of cases remain unexplained. The cause could not be identified. What lesions can affect the fallopian tubes? About 25% of cases of female infertility are due to a tubal factor, i.e. an alteration of the fallopian tubes. Under normal conditions, the tubes act like a fishing rod. They catch the egg released at the time of ovulation, carry the sperm to the egg and lead the already fertilized egg to the uterus. The deterioration of the tubes, whether partial if it results in adhesion, or total, in the event of obstruction of the tubes, will prevent this displacement and, consequently, fertilization. Origins of the tubal lesion. Infections moving up from the cervix or uterus to the tubes, pelvic inflammatory disease, PID, or which act continuously from the abdominal cavity, appendicitis. The germs most frequently involved in PID are, among others, gonorrhea and chlamydia. Previous pelvic surgery which would have resulted in adhesion phenomena in the tubes or endometriosis. Peritoneal tubal factor is often also associated with ectopic pregnancy, that is, when the embryo does not reach the uterine cavity due to an abnormality in the diameter and the inner part of the tube, which prevents proper displacement. What is endometriosis and how many women have it? There is a strong correlation between endometriosis and infertility, as 10% of women suffer from it and 35% of infertile women have this disease. Its name comes from the word endometrium, a tissue that lines the inner wall of the uterus and that comes off each month during menstruation. Endometriosis is the appearance of this tissue outside its usual place, in other words, outside the uterus. It then usually attaches to the ovaries, fallopian tubes, ligaments that support the uterus, and the wall of the pelvic or abdominal cavity. This tissue is sensitive to hormonal changes that occur during menstruation, which causes a number of symptoms. While it is true that some patients have no symptoms, endometriosis usually manifests with pain and infertility. Pain may only appear during menstruation, but a woman may also have gastrointestinal or urinary symptoms when endometriotic implants invade other organs such as the intestines, bladder or rectum. Infertility associated with endometriosis can derive from changes in the pelvic anatomy of patients during menstrual cycles. It can cause tubal obstruction or the formation of ovarian cysts, which in some cases will require surgery, resulting in loss of ovarian tissue and reduced fertility. What are the factors that can decrease fertility? While women are increasingly affected by infertility, the number of men who cannot conceive is also on the rise. Relayed by our colleagues at 20 Minutes, the reasons for male infertility are a 50% drop in the quantity and quality of sperm. This development is based on the last 30 years. Other things such as later age of first pregnancy, smoking, endocrine disruptors, cannabis use and certain drugs can explain that men and women cannot conceive children. Nathalie Massin, manager of a Center for Medically Assisted Procreation, also called PMA, explains that infertility involves two partners and always results from several factors. We have the feeling that it is getting worse, says infertility specialist Stéphane Droupy, also author of the book Demain, tous, infertiles? According to an Inserm publication dated 2018, 18 to 24% of couples remain childless in France, after 1 year of attempts without contraception. The age of the first pregnancy is increasingly late. While men can also be impacted on fertility, women are impacted by the average age of the mother to have her first baby. According to the National Institute of Demographic Studies, INED, the latter was 24.7 years in 1972 and rose to 28.5 years in 2017. The reason why age is a predominant factor in fertility potential is at age 25. The probability of conceiving per cycle is 24% while it is 12% at age 35. At 40, the chances of pregnancy are 5%. Contrary to popular belief, men also have a biological clock, although men have a higher probability of having an older child than women. Stéphane Droupy explains that when he establishes a diagnosis of infertility, men are little aware of the factors that can prevent having a baby. He testifies, "They answer me, 'In my family, there is no problem.' We stuck with the idea that fertility is passed on from father to son." Two diseases can also lead to receiving assisted reproduction. Infertility can be caused by genetic factors, but certain diseases can cause it. When a couple feels that there is a risk of infertility, doctors may order a battery of medical examinations because certain conditions can decrease the chances of conception. For women, endometriosis, a disease that affects 1 in 10 women, as well as polycystic ovary syndrome, which affects the same female population. 50% of women who have difficulty having a baby may be affected by irregular or non-existent ovulations. 3. To get pregnant, it is better to avoid certain medications. Nathalie Massin, reproduction doctor and president of the Society for Reproductive Medicine, explains that certain drugs can affect the chances of conception. When taking these potentially harmful treatments for pregnancy, it is also recommended to find a solution to preserve fertility. The specialist stresses that more harmless drugs such as those to prevent hair loss or treat certain rheumatological diseases can threaten the couple's fertility. 4. Environmental causes alter female fertility. This infertility is not only the result of endogenous factors such as heredity, other causes that arise from our environment can impact the number of births. Nathalie Massin indicates that endocrine disruptors also have a role to play in the decrease in fertility, which can impact both men and women, although this action is difficult to prove. These chemicals of natural or artificial origin can be found in food, packaging, but also in beauty products. And can be responsible for hormonal imbalances and, as a direct consequence, reproductive function. The specialist stresses that pollution is not to be outdone. A large American study shows that the more people live near a large, highly circulating artery, the more they are affected by infertility problems, attests the expert. Besides, there are 10 amazing reasons that can prevent a woman from getting pregnant. 5. The hygiene of life has a role on the hormones. Other exogenous causes can impact women's fertility but also their overall health, namely tobacco and cannabis. Nathalie Massin explains that the embryos of smokers develop more slowly and that their fertilization rate is lower than those who do not consume tobacco. Diet also plays a role in the ability to have a child. The expert mentions an American study which shows that the consumption of refined sugar impacts the implantation of the embryo in the event of IVF, namely in vitro fertilization. It's the same proportion for cigarette smokers, she warns. What are the other causes of infertility in women? Reviewed by Dr. Jacques Allard, general practitioner, other reasons affect a woman's ability to conceive. Like the environmental factors and those linked to the pathology, they can be multiple. As said before, an ovulation disorder called anovulation can be the cause of infertility. The latter prevents the production of an oocyte and therefore to have a baby. Fallopian tubes may be blocked due to salpingitis, an inflammatory disease of this area of the reproductive system. Thyroid disorders and hyperprolactinemia can also impact female fertility. The latter condition is characterized by a high level of prolactin, the hormone secreted during breastfeeding. This pathology affects ovulation. If some women can suffer from it, this is definitely not the case for this mother. And for good reason, she has an impressive fertility rate because she has 44 children.